Hi everyone, welcome to the 13th Annual Nurses Conference. We are privileged to have this meeting as a part of the annual SSBMT conference in collaboration with EBMT. I would like to thank EBMT Nursing Committee for co-organizing this meeting with us. I would like to thank all speakers from SSBMT and EBMT. I would like to thank all the speakers from SSBMT and EBMT. The program will have 2 sessions with different topics. I wish you all informative program. Please let me welcome Ms. Hilda from EBMT Nurses Group for welcome remark. Ms. Hilda, mic is yours. Transplantation nurse at William Alexander Children's Hospital and researcher in the Department of Medical Ethics and Health Law. In addition to her clinical and academic roles, Hilda served as a president of the EBMT Nurses Group. Ms. Hilda, mic is yours.
Thank you so much. And it's my pleasure to do these welcome remarks on behalf of the EBMT Nurses Group. And I would like to present you I would like to welcome you on behalf of the EBMT Nurses Group, and I would like to welcome you to this 13th Annual Saudi Hem-Onc Nurses Conference. Thank you so much to the organization, to Noor Kaya and to Mariam Ahmad-Tourai for this great initiative and organization of this day. Huge congratulations with this excellent program. And let me introduce the EBMT Nurses Group to you. As Nurses Group, we are part of the EBMT, and we are a group of EBMT. The EBMT Nurses Group brings together nurses and allied health professionals working in the field of HCT and cellular therapy. And we do that by improving the care of our patients through evidence-based practice, to enhance and value the nursing role worldwide, and by supporting and sharing knowledge through communication, advocacy, research, training, and education. And this picture shows you an overview of the EBMT Nurses Group. And in the middle here, you can see the EBMT Nurses Group board, which we consist of a president and a secretary, and sometimes also a president-elect or past president. On the left side, you see a list of all more medical working parties. And in each of those working parties, we have a link nurse collaborating with us and also collaborating together with the lead of a lead nurse. Then we have 4 committees, a scientific committee, a research committee, the pediatric committee, and our global education committee. And at the bottom, you can also see that we collaborate closely with national groups. And in this picture, I will explain a bit more about the committees. The scientific committee first aims to coordinate and organizes the annual conference, including symposia and the educational day, usually on Sunday. Next to that, we have our research committee, which aims to coordinate and lead the development of research programs in hematopoietic stem cell transplant and cellular therapy. Then next to that, we have the pediatric committee, who aims to improve the care of pediatric and adolescent HCT and cellular therapy patients, and to promote, develop, and share knowledge between pediatric nurses. Lastly, we have our Global Education Committee, who aims to coordinate and organize outreach meetings in cooperation with other non-profit associations with the same mission and objectives. And in this map, you can see that we have a lot of nurse members across 66 countries worldwide. And I also see your country involved in this picture. It's not totally that all members are included here, because I know that a lot of nurses are active, for example, on the member center list. So I guess there are more nurses involved than these 1,200. What we do, can you bring together to 3 main pillars, which is education, research, and projects. And in that, we also support nurses with grants, and these grants will usually become available in June. And there are several grants, and you can apply to that by sending your CV and a motivation letter. And then after June, we will read them and let the results know. And sometimes when there are grants available during the rest of the year, we will re-advertise them. But we also do a lot of communication, for example, by the newsletter, but also by the social media channels. And we try to give support wherever needed. And sometimes that's also in other countries who are developing their transplantation or cellular therapy programs. And of course, we advocate for nurses in HCT and cellular therapy where we can. And what is also listed here is that we do research. We do research in collaboration with the working party nurses or with the working parties and sometimes on ourselves. And I will list some of our highlights of the projects we do at the moment. And during the annual meeting, which we held in Madrid this year, we launched our first EBMT exam for nurses, including a preparatory course. And this preparatory course could be followed online. And it is based on our nurses group textbook. And if nurses completed both the preparatory course and the exam, they get the certification, which could be a great acknowledgement for the experience and knowledge of nurses in HCT and cellular therapy. And especially when such education is not organized in a certain country, this might be of a very high value. And then next to that, we also have our digital skills videos, and Marrow, aspirate and Trifine, but also on the insertion and management of peripherally inserted central catheters and thawing and then last but not least, we also have our EBMT nurses group textbook, which was already available in Italian, French, German, Polish, and Spanish. And this is just a couple of our highlights. To know more, we have the website and newsletter. And I highlighted on this picture the nurses section on the page. And if you enter the website, you can find a lot more here. And if you want to subscribe for the newsletter, you can click on the button at the right side, and then you subscribe for the newsletter and can tick the boxes where you are interested in. And I also would like to point your attention to our 18th educational meeting of the EBMT Nurses Group, which will be held in Dublin in Ireland in October 2026. And then lastly, we also have our 53rd annual meeting next year in April in Rotterdam. And yeah, probably we can see some of you there as well. And if you want to submit an abstract for that conference, that will be opened, I expect, after the summer. And the deadline for submission will be mid-December. Then after submission of those abstracts, this will be followed by a blinded review process by a panel of nurses who all give a score between 1 and 10, followed by a thorough discussion within our committees based on mean scores and comments. And these are the general requirements. The abstract should contain max 500 words, should be in English, original work, and usually one table and one image can be included. It's not necessary, but it can be. And the following structure should be followed: background, method, results, and conclusions. And if you want more guidance how to submit an abstract, there is also a nurses group abstract guidance document, which is easy to follow for you probably. And there's also an episode on our podcast of the EBMT nurses group. And additionally to that, on the website, you can also find a webinar focused on abstract submission. So I would like to thank again for the organization and everyone involved for making this fantastic day possible. And I'm looking forward to ongoing collaboration with the SSBMT. And I wish you all a very, very inspiring, meaningful, and energizing meeting. Thank you so much.
Can I ask you about the nurse exam? Because actually this is, I think, the first time to announce there is EBMT nurse exam. We saw that before the videos and educational material, the ebook, but for the exam, any nurses can be submit for this exam?
Yes, all nurses can apply for this exam, and you have to subscribe yourself, and then you can follow the online preparatory course. That's not mandatory to do that, but it's recommended to do, and it guides you actually through the whole process and it's based on our textbook. And then actually it's very useful to also do the quizzes between which are included into the preparatory course, and then you can follow the exam. We are currently discussing how we can improve the access to the exam, but because last year we opened it only on site in Madrid, but for next years we are discussing that it would be also possible to do the exam online or during other meetings. So I hope I can bring some good news soon.
Because we have time. Anybody?
I just have one question.
Yes.
For the EBMT nurses group meeting, who are those people can attend? Is it only members or any nurses from any region, any country?
Yes, thank you for this question. And any nurses of every region can join our meetings. Of course, they are always open for everyone. And I can let you know that there are still grants available for example, for the meeting in Dublin. So if you go to our website and you try to find the educational meeting in Dublin, for example, there are still grants available to join us there. And also, if you don't need a grant, you can also join us. But yeah, of course, it's open for everyone.
Thank you so much, Ms. Hilda. Any more questions? No more? Thank you, Ms. Hilda. We are a pleasure to have you in our SSBMT. Thank you, and really appreciate you represent with us. Thanks a lot. We will go for the second subject. Thanks a lot.
Thank you.
Is Dr. Isakon online?
Yes. Well, I think I needed also to give another presentation. Is that right? I also needed to give a best of the best presentation. Yeah, sorry. I will share my screen. You see my screen, right? Okay, then I would like to also present you the best of the best of the annual meeting. And actually, I will present 5 of the best abstracts. And of course, I can only very shortly address these. So if you want to know more, you can go to the website and try to read their abstracts. And in total, this year we received 184 abstracts, and we offered 28 oral presentations and 133 poster presentations. Only a couple of them were rejected, and more than 30 countries were involved. And here you can see an overview of the countries that were involved, with on the top the UK and China, but it was very nice to see that a lot of countries contributed with abstracts this year. So it was also lovely to see your country included here. Now I'll present the Best Adult Oral Presentation Abstract Award. This was given to Nina Canova from Switzerland, and she presented on journey mapping as a method to explore the adoptive cell therapy experience of patients, informal caregivers, and healthcare professionals. And the aim of their study was to explore patients, informal caregivers, and healthcare professionals' experiences and the perspectives with adoptive cell therapy. And they used a qualitative exploratory design using purposive and pragmatic sampling. Their participants included patients, informal caregivers, and healthcare professionals. And they used semi-structured interviews with psychological processes mapping activity. And their analysis included transcription, content analysis, frequency of reported psychological impact at each stage. And These were the main results. They were able to analyze 43 maps, and which shows that adoptive cell therapy pathways are highly emotional and ambivalent, according to the respondents. And in the therapy presentation, hope for life extension coexist with fear, and fear pointed to the toxicity, complexity, uncertainty, and efficiency. Then during the pre-treatment phase, increased stress was seen due to the diagnostics, logistics, hospitalization, and clear communication in this builds trust. During the treatment, relief and hope was mixed with fear and unexpected toxicity intensity. And in the post-treatment outcomes, the researchers identified both positive and negative outcomes, and positive like joy, gratitude, cautious optimism, and negative pointing to sadness and anger. And across all the phases, fluctuating social support was seen, but also loneliness and a sense of control. And the coping strategies that were used by patients was emotion-focused, problem-focused, and meaning-focused. And the key gaps identified by healthcare professions were the underestimation of pre-treatment coordination burden and underestimation of post-treatment physical debilitation. The highest unmet needs were pre- and post-treatment phases, the priority targets for psychosocial interventions in the future. And this study concludes with that this study identifies critical psychosocial pressure points across the adoptive cell therapy pathway, and there were discrepancies between healthcare professionals' perceptions and the lived perspectives and experiences of patients and carers. And this highlights the importance of proactive, structured psychosocial assessment and the need for targeted support interventions at key moments. And this method, the journey mapping, provided a valuable in capturing emotional shifts and revealing unmet needs that are less evident in traditional interviews, offering actionable insights to strengthen person-centered care across the adoptive cell therapy services. Then the next award went to the best pediatric oral presentation. And that was Isabel Salcedo from Spain, and she presented on safety profiles of two anti-thymocyte globulin formulations in pediatric hematopoietic stem cell transplantation, and they reported also on the implications for nurses. The aim was to evaluate the incidence of adverse events associated with the administration of grafalon on the one hand and thymoglobulin on the other hand in pediatric patients undergoing HCT. The design was a retrospective cohort study, multi-center, and the data were based on electronic health records. They included pediatric patients between 0 and 18 years old, undergoing hematopoietic stem cell transplant since 2018, and a receipt of thymoglobulin and grafalon as part of the pre-transplant conditioning regimen should be in their health records. They excluded simultaneous use of both drugs, and also the use of ATG for GVHD. So this picture is showing the results. As you can see here, they included 4 hospitals in Spain, and in the cohort, thymoglobulin was used in the orange parts and grafalon in the blue parts, and over 400 patients were included. So that's quite a big study. I cannot show you all the results, which were actually quite interesting, but the main result was that there is a higher risk of capillary leak syndrome with thymoglobulin compared to grafalon. And also more ICU transfers within 72 hours were seen, like 15 children out of 251 treated with thymoglobulin were transferred to ICU within 72 hours of ATG initiation, with a mean stay of 2.67 days. But none of the 171 treated with grafalon required ICU. So in conclusion, grafalon demonstrated a more favorable safety profile during the 24 and 72 hours of ATG infusion compared to thymoglobulin, and higher incidence of capillary leak syndrome and ICU transfer with thymoglobulin underscores the need for adequate nursing staffing ratios and well-trained nurses to ensure patient safety. Although retrospective studies may have some limitations, to their knowledge, this was the first study on this comparison on pediatrics and with an important sample size that leads to meaningful conclusions. but prospective and randomized controlled trials are needed to confirm the findings. And what it also shows that multi-center nurses-led studies based on their bedside observations are feasible and necessary to provide an evidence-based care to our patients. Okay, I will rush a bit. Then best research on the oral presentation on, the best research oral presentation went to Sabine Valenta on emotional burden predicts mortality 5 years after adult HCT. That was a prospective Swiss transplant study. The study aimed to evaluate the evolution of emotional burden and its impact on overall survival from pre-transplant to 5 years post-transplant. They had 3 sub-aims, as you can see here. They used the following design: a multi-center prospective open national cohort study with secondary data analysis of the Swiss transplant cohort study. The setting and sample was that all 3 Swiss centers were included and adult patients after transplant were included between 2013 and 2018. The data sources were, on the one hand, the psychosocial questionnaire, and on the other hand, EBMT registry data. And here you can see the results. On the horizontal axis, you can see the different time zones are before transplant, after 6 months, after 12 months, and after 24 months. And in blue, the clinical insignificant depressive symptomatology, 8 to 10, the orange one, borderline depressive symptomatology, and the greens showing clinical significant depressive symptomatology. And here were represented anxiety levels, same way of presenting it, a bit quite some slightly and moderate anxiety levels here. And also here is shown the perceived stress assessed using a single item 5-point Likert scale. And you can see that rather much and very much stress levels were reported here as well. And overall, these results also shown that there was a higher risk of mortality in all these groups of patients. So it was really associated with each other. So the conclusion was that emotional burden independently and robustly predicted poorer 5-year overall survivor in HCT recipients, and the findings highlight the clinical relevance of systematically assessing emotional burden and integrating timely psychosocial support into post-transplant care to potentially improve long-term outcomes. The next, the best adult poster presentation, which went to Alexander Istomin from the Ukraine on global collaboration. They saw an increase of transplants in their country, but there were also unmet needs of education, and they sought for a collaboration with the WBMT nurses group and using an educational program. Consisting of several steps, they reached out, they developed a program, they raised funds, produced video materials. They produced a course with translation to Ukraine with expert views, and then it was opened for the audience. And 11 nurses from 11 of the 11 centers participated here. And they also had a 5-weekly modules delivered via Zoom meetings with different aspects of the modules. And they did a post-test and satisfaction survey. And they also included one hands-on workshop about CVL care. And as you can see here, quite briefly, 75% of the applicants successfully finished the course, and 82% find it very clear and relevant. So this highlights actually that the need for structured nursing education in Ukraine was scalable, and it was a resource-efficient model for expanding easy access. Then the last one, the pediatric poster went to Dina El Mouzain from the United Arab Emirates, establishing the first pediatric bone marrow transplant nursing program there. And their aim was to create sustainable framework for nursing excellence through structured education, validation, and mentorship. And they collaborated with the Boston Children's Hospital. They included an educational program and implemented that and developed that in collaboration with Boston Children's Hospital and the Abu Dhabi EBMT nursing educators. And they also evaluated pre-post directly and 6 months competency revalidation cycles. These were their results. They had some indicated nursing competence, nursing confidence, patient satisfaction, antibiotic administration within 30 minutes, and nursing documentation. And as you can see, in the purple bars were the post-program indicators, and the red ones were the baselines, and you can see a very nice improvement in all of these indicators until almost 100%. So this was really a nice achievement for them. So their conclusion was that through structured education, mentorship, and capacity building, the Abu Dhabi BMT program established the United Arab Emirates' first pediatric BMT nursing program, achieving Certificate of Excellence Effect accreditation. And their collaboration with PCH and implementation of a framework resulted also in measurable improvements, and the development of local instructor capacity ensures sustainability, knowledge transfer, and scalability. So their abstracts are all available at the EBMT website and also the other abstracts. So if you want to know more, you can have a look there. So thank you so much for your attention.
This presentation, any question? Appreciate your presentation. Thank you so much.